Hello and welcome back to Tar Heel News with the Tar Heel News crew. And we have reports on the North Carolina Medicaid program. We're going to elaborate a little about the Medicaid cuts and their impact because the North Carolina Medicaid program is facing significant challenges due to a state budget impasse and looming federal cuts, resulting in immediate reductions in provider reimbursement rates and threats to access to care for over 3 million residents. And the details of the cuts and the rate reduction effective October the 1st, 2025, the North Carolina Department of Health and Human Services, DHHS, implemented cuts to provider payments ranging from 3% to 10%. In hospitals and nursing homes and psychiatric residential treatment facilities faced a 10% reduction. Primary care doctors saw an 8% cut, while other services like speech therapy, child development, and care management were reduced to 3%. In the service elimination, the state also ended Medicaid coverage for certain non-FDA approved users of popular weight loss drugs, GLP-1s, and scaled back some operational support and contracts for integrated care pilot programs. And also, they have the political standoff to this. The cuts stem from a funding shortfall that the state legislation failed to address before adjourning due to a political standoff between the House and the Senate over unrelated issues such as a new children's hospital and tax cuts. And House lawmakers passed a bill to provide partial funding to delay the cuts, but the Senate recessed without taking it up. Now, the impact on providers and recipients reduced access to care. The primary concern is that lower reimbursement rates will drive many providers, especially those in rural areas with already thin operating margins, to stop accepting Medicaid patients or potentially close altogether. And this would lead to longer wait times, delayed diagnosis, and worse health outcomes for the state's most vulnerable populations, including children with complex needs, the elderly, and people with disabilities. And the financial strain that it's going to put on the hospitals face increased uncompensated care costs as more people become uninsured or underinsured, which could force them to raise prices for everyone else or reduce essential services. And the expansion at risk is that federal legislation, the One Big Beautiful Bill Act, signed into law in July 2025, includes nearly $1 trillion in national Medicaid cuts over the next decade and new work requirements that could jeopardize North Carolina's recent medical expansions. Some officials warn that the combination of federal changes and a clause in the state expansion law could cause all 600 and 80,000 newly covered residents to lose their benefits if the state is forced to pick up any costs. Increased paperback and burdens, new federal requirements for frequent eligibility checks and work status verification will create an administrative burden on already overworked county staff, potentially causing eligible individuals to lose coverage due to red tape. And this about the Medicaid. A lot is going on with that, people. A lot is going on with that North Carolina Medicaid program.